Welcome to Nat English Learning Family, your one-stop destination for mastering English and excelling in IELTS, PTE, and OET exams. Today, we're going to practice a real OET speaking roleplay for nurses. You'll see how to communicate clearly, build confidence, and perform well in the exam. Let's get started. Here you will hear the roleplay conversation between Nurse Sarah and patient Ahmed. Let us begin.
Good morning, Mr. Ahmed. My name is Sawa. I'm one of the nurses looking after you today. Before we start, can you please confirm your full name and date of birth?
Yes, I'm Ahmed Ali. My date of birth is 10th of June, 1970.
Thank you, Mr. Ahmed. I can see from your notes that you were admitted last night with a chest infection. How are you feeling at the moment?
Honestly, not very good. I'm still short of breath and I'm a bit scared. I've never felt like this before.
I'm sorry to hear that you're feeling so uncomfortable, and I understand it can be frightening when you struggle to breathe. I'm here to explain what's going on and what we're doing to help. Is that okay?
Yes, please. I really want to know what's happening.
Of course. The doctors think you have a chest infection, which means there is inflammation and extra mucus in your lungs. That makes it harder for air to move in and out, so you feel breathless and tired. The good news is that this kind of infection usually responds well to the treatment we've started.
So, what treatment am I getting?
At the moment, you are receiving antibiotics through the drip in your arm. This helps fight the infection more quickly than tablets. You are also on a small amount of oxygen through the nasal prongs to make your breathing easier. We will check your temperature, oxygen levels, and blood pressure regularly to make sure you are improving.
Will I need to stay in hospital for a long time?
It depends on how your body responds, but in many cases patients start to feel better in a couple of days. Once your breathing is more stable and you no longer need oxygen, the doctor will talk to you about going home. For now, the most important thing is to rest and let the medicines do their job.
I'm worried because my family is at home and I'm the main person who works. What if this is something serious like a heart problem?
I can hear that you're really concerned about your family and your health, and that's completely understandable. Based on the tests we've done so far, this looks like a chest infection rather than a heart attack. However, the medical team will keep reviewing your blood tests and chest x-ray to be sure we are not missing anything. If there is any change, they will discuss it with you straight away.
Okay. Is there anything I can do to help myself recover faster?
Yes, there are a few things that can really help. First, try to sit upright or in a slightly raised position rather than lying flat. This usually makes breathing easier. Second, take slow, deep breaths when you can, and use the call bell if you feel suddenly more breathless or dizzy. Also, drink small amounts of water regularly, unless the doctor has told you not to, as this helps keep the mucus thinner.
Sometimes I cough a lot and it's painful. Should I try not to cough?
Coughing can be uncomfortable, but it actually helps clear the mucus from your lungs, so it's better not to suppress it. When you feel a cough coming, you can hold a pillow gently against your chest to support the area and reduce the pain. If the pain becomes too strong, let us know so we can give you appropriate pain relief.
That makes sense. I also smoke. Is that making it worse?
Thank you for being honest about that. Smoking does irritate the lungs and makes infections more likely and harder to recover from. While you're in hospital, we can offer nicotine replacement to make it easier not to smoke. When you're feeling better, we can also refer you to a stop smoking service if you'd like more support.
Maybe this is a good time to try to quit. I don't want this to happen again.
That's a really positive decision, and we'll be happy to support you with that. For now, I'll continue to monitor your breathing and give your medications on time. If at any point you feel more breathless, have chest pain, or feel very anxious, please press the call bell and we'll come straight away.
Thank you. I feel a bit calmer now that I know what's going on.
You're very welcome, Mr. Ahmed. I'll come back in about half an hour to check your observations again, but remember, if you need anything before then, just let us know.
That's the end of the test. I hope you learned something useful from this nursing roleplay and feel more confident for your OET speaking exam. Thanks for watching. Like, share and subscribe for more exciting content.